Welcome to Home Care Connection, a program brought to you by the Rutland Area Visiting Nurse Association and Hospice. The goal of the program is to educate you about the many resources available to you when you are in need of care at home, whether you're recovering from surgery or managing chronic illness. My guest today on the program is Cindy Wilcox. Welcome back to the program, Cindy.
Thank you, Harry.
Cindy is a home care nurse with us at the VNA. So many people are taking numerous drugs for different conditions, and that can be confusing and even dangerous. Having a better understanding of medicines can protect you from serious side effects and serious reactions. We invited Cindy back to the program to talk about how you can become an active partner in your medication program. This includes understanding the terms that your doctor or nurse uses when talking to you about your prescriptions and knowing why certain medications have been prescribed. Cindy, you believe that what you don't know about medications can kill one, do you not?
Absolutely true.
Well, Cindy has provided us with several areas of medication management so that we hope you will be able to pay attention to. Let me first tell you what they are, and then we will get into the details. People's attitudes or philosophies about medication, the difference between brand name and generic drugs, medication dosages, frequency of taking medications, the purpose of the medication that you're taking, the action of the drug, the science of drugs, and drug interactions. So let's start right at the top with people's attitudes about medication. What do we mean by that?
Well, as I travel from home to home in my work, I find a lot of people are very much afraid of medication. Any type of man-made chemical somehow frightens people. I think we need to have a heightened awareness of how our whole world is made up of chemicals. There are God-made or nature-made chemicals, if you will, or there are man-made chemicals. And the man-made chemicals that we have are pretty thoroughly researched and studied through elaborate scientific process. And sometimes we're more afraid of those types of chemicals than we are about the additives found in the processed food that we eat, for example, which could, in certain cases, be more harmful to us than any drug we could ever take. Absolutely. So having a good, healthy attitude toward the science of chemistry and chemicals that we are, our whole life is full of chemicals, both organic and inorganic chemistry. So even a blade of grass has a chemistry to it. So I think people just have to not be afraid of that idea of chemicals and chemistry. And then beyond that, they have to understand management. And I don't care if you're the manager of a widget factory or a store or your own health care. It is the idea that you set into place a plan of action, that you want to derive certain things to happen, certain outcomes as we say. Yep. And you assess whether that plan is working. As it applies to medications, let's say people have a long list of medications and it's hard for them to remember what they took or when to take it or how to take it. So we encourage people at Visiting Nurses to have a sound plan, either by utilizing some form of medication compartmentalized box that they use on a day-to-day basis and that they fill with all their routine medications so that there isn't a lot of agonizing on a day-to-day basis about, oh, did I take my pill? Well, if the little compartment is empty, guess what? You've taken it. You've taken it, rather. Or if you write out a list, or if you have a graph, like if you have a calendar, and you make a little checkoff system, whatever system that you have should work for you. Unfortunately, I go into a lot of situations where the system that is in place is not working for the patient. And there are a number of reasons for that. And so one of the things we do is try to assist the patient in developing a better system so that they have a more beneficial outcome and they become a better manager of their own health treatment plan as it applies to medication.
And really, when we talk about, when you talk about patient or people's attitudes toward medication, I've known a lot of people, even family members, who they'll say, you know, I'm not a pill taker, and it really does reflect that sort of man-made chemical piece. But what I also think is really important in what you just said is that if I am going to have whatever it is, a physical condition that requires some type of medicine, that I need to approach it like I'm managing my health care, like the pills or whatever it is that is being prescribed to treat my condition is something that I can manage, and something that if I approach it that way, that's the proper attitude for approaching.
That's correct. And built into the management of the medication is also arming yourself with other tools like knowledge about the medication, and not just what the drug is, but how it is utilized by your body and how we get rid of the drug. And the more that you can know about this, and the more that you can have solid, beneficial relationships, not only with your physician, but also with your pharmacist, because they are an incredible resource. When nurses have tools. We have handbooks that we use. And you can see the thickness of this one book. You can imagine what the doctor's handbook looks like, or the pharmacist's handbook, whose sole job is the study of all the pharmaceuticals that we put into and onto ourselves. So if we don't fully understand something that's going on with the patients, we very often will intervene for the patient and call the pharmacist or call the doctor and say, there's something happening here and I'm not sure what it is, but whatever the case may be. So if you have knowledge and you have a good system, you have a much better chance of being a good health manager and having a better outcome with whatever ailment you're trying to favorably impact upon.
So why don't we, speaking of sort of knowledge, you know, people hear all the time, you know, generic versus brand name drugs. I think that is a somewhat confusing topic. Can you help?
I can talk briefly to that. I do know that when a drug company invests a lot of research time and resources into developing a new drug, and they do get it approved by the federal government, the Food and Drug Administration approves the drug after, you know, countless numbers of research studies and what have you, then they are allowed to keep that drug solely for themselves for 7 years, and that's how it's patented. And the chemical name of a drug is about a 25 to 35 syllable long drug that we could spend from here to the end of the program trying to pronounce, and usually no one deals with that but the actual drug companies. The brand name is the what the drug company who developed the drug gets to name their chemical.
Like the trademark name.
Exactly, and that is called the brand name, and that's why when drugs first come out, they're so expensive, because part of what the drug companies are trying to do is to retrieve a lot of that research and development money in addition to making their allowed profit. And then after 7 years, the drug goes into a general pool of all drug companies who can. And this is where it gets confusing, because other drug companies can make it whatever shape, whatever color, and they can call it whatever name they choose, and then all of the confusion follows, because very often people will not recognize that it's the same drug that they were taking, but their pharmacist has, and their doctor has allowed them to substitute a lesser expensive or a more affordable generic version. And sometimes there's problems with people being able to tolerate that. And so it's good to have an awareness of whether you're actually getting the brand name or the generic.
And in fact, actually, especially because most of us, at least those hopefully who are receiving medical treatment, are covered under one form of health insurance or another. Actually, in many cases, the insurance companies sort of will say, use the generic drug if it's available. But so the generic drug is really, I guess maybe the way I see it is like Advil is a brand name of a particular type of painkiller.
That's correct.
Whereas ibuprofen, which you can buy in any drugstore under the drugstore's name, that's what really is the main thing in Advil.
That's right.
And Advil is what my research and development team developed. That's the brand name.
That's right.
Ibuprofen is just
generic.
Right.
Generic.
And if the ingredients for the most part are mixed the same, it's pretty much the same drug.
Yes, exactly. In order for insurance companies to, if there's a problem with a patient taking a generic, a doctor has to write a reason for why this patient can't take the generic, and then it's up to the insurance company as to whether or not they will approve the brand name. I have had a family member who could not take a generic, and in fact had to have his doctor write a letter stating the reasons why, and then the insurance company reimbursed, but at a higher rate, because it was a brand name that was just brand new, and it's much more expensive.
Okay, so we have an idea of what is the difference between a brand name drug and a generic drug. I think something else that seems to be, although fairly straightforward, maybe perhaps not quite as well understood as it could be, is the dosage of a drug. Maybe you could talk a little bit about what dosage actually means.
This is an area where when I find people making some errors in the management of their medication, this is most frequently the area where I will find those errors. People will pay very close attention to the name of the drug, lesser attention to the dosage. And if they go into a hospital or a nursing home and then they come back home, a lot of times those dosages will shift. And they'll look at the drug and say, oh yeah, I'm still on that. And it might be increased, it might be decreased. So people need to have an awareness if they're taking 200 milligrams or if they're taking 100 milligrams and the doctor wants them to take 200, then they have to take 2 100s, and they just have to pay attention to the denomination of what strength the drug is, and not to be fooled or misled by the size of the pill. Just because a pill is small does not mean that it is not strong. You can, and it's how the body reacts to it, it's how it binds to certain parts of the body, how it's absorbed into the bloodstream, and you can't go by size. That's no indicator of strength. But knowing dosage is crucial, and not to confuse tablespoon with teaspoon, milliequivalents with micrograms, milligrams with micrograms, and so on and so forth.
And it's funny. So not funny, but I was going to give you a sort of a little story, but I think I'll skip it for now, because I think what you're saying really is that the dosage is the strength of the pill, the thing itself. And so really, I may have had this drug yesterday, and I may be getting out of the hospital tomorrow, and I have a prescription for that drug, but really the dosages of those could be different. And like you said, they could either go up or down because the sort of arc of my condition, obviously something's changed from when I was in the hospital, or otherwise I'd still be in the hospital.
I would really like to emphasize that point. to our viewers, please, please, please do not make the false assumption that you go back to taking the medications that you were on prior to being in the hospital. The whole reason for being in the hospital is to have your condition re-evaluated. Right. And during the process of that re-evaluation, your medications can change.
Absolutely.
And in this day and age, your primary doctor is not necessarily following you in the hospital, but another doctor is taking over the role of your doctor and has the authority to make those changes. Right. And then once you get back home, your doctor, your regular office doctor, can catch up with those changes, but you really should not make the assumption that everything is status quo because, oh, I'm better. You very well may be better because they made those medication adjustments.
Absolutely.
And
Absolutely.
you could fall right back into the same trap if you go back to the same. I think that's a very important point, and thank you for bringing it up.
Well, so dosage is, I think, one dimension of sort of strength and or the way that the prescription drug is used. The other is frequency.
Yeah, another thing people need to be acutely aware of, again, in managing their own medications, because we do put an awful lot onto people and in terms of what they need to know. And so again, the more that you can arm yourself with knowledge, the better off you're going to be. And the thing I want to say about frequency is, just very briefly, because we have other areas we need to cover, but what I want people to know is, please understand that there is a difference between something that you take 3 times a day, period, and 3 times a day as needed. That's the most important thing I think people need to be aware of. And if you're not sure what the drug is for, how are you going to know if you need it? So, yeah, don't make the mistake of confusing 3 times a day with 3 times a day as needed. Now, granted, you might be needing it 3 times a day, which is fine. But the whole point is, if I don't need to take a pain pill 3 times a day, I can really be doing myself harm by taking it a 3rd time when I don't need it. I can make myself sedated. I can cause terrible side effects from the drug, and I can have a lot of repercussions from taking it when I don't need it. So understand those differences clearly is my message about that.
Well, and I think that's, I think the way you've stated that, it makes for a nice segue because, again, sort of continuing along this line, now I know that I have a generic version of this drug. I know that I've looked and made sure that I know what the dosage is and whether or not it's changed from what I was doing before. I read the label and it says take, 3 times a day after eating.
I'm going to just stop you for a second there because you just made me think of something. I'm going to read label. Here's another pitfall. You may go back to reading your labels and the label may not be up to date because your pharmacist is not going to know that you went into the hospital. And if this was a drug you were previously taking twice a day and you're now taking it 3 times a day, that label is not going to reflect that change unless someone, either your doctor or the hospital, gets in touch with your pharmacist
and updates the prescription.
And updates the pharmacist so they can change the label. So that's another very important point you just mentioned, and I really want to stress that to people. If they rely, if their system, I just read the labels. I caution people on that system because a lot of times also a doctor will call, or a patient will call a doctor, and a doctor will say, you know what, I think you better start taking that twice a day instead of once. Now he's just given that patient a directive over the phone. Pharmacy has no awareness of that. He may or may not remember to make a notation in the patient's chart. And if you don't have a system in place whereby you can reflect that change, and all you do is read labels, you're going to make a mistake. So I strongly recommend keeping a very, very detailed list of all the medications that you take and the frequency with which you take them.
That's great. Yeah, I think that makes a lot of sense.
And keeping it up to date,
well,
which is the hard part.
It is, because again, like you just said, I mean, and I think that's very true with a number of medications that depending on like Coumadin, I only know that because I have family members who use it. I mean, depending on the test results, when they go and they have their blood tested, the doctor says do this or do that with their existing prescription. And you know, again, I think that those are the kinds of things that, you know, that do happen over the phone.
You know, communication and verbiage is very important. I try to teach my patients to always refer to their Coumadin or warfarin or Jantoven. Again, many different names, same medication. I try to really coach them to refer to the medication dosage in terms of milligrams. Oh, I take a tablet every other day, and then on alternate days I take a half a tablet. Well, my dear viewers, Coumadin comes in about 20 different strengths.
Right.
A half a tablet of what? A 20 milligram tablet, a 0.5 milligram tablet makes a huge difference.
Sure does.
Huge difference.
And so now that I've been listening to the show, and now I'm like, okay, I think I know what I'm taking and how strong it is and how frequently. But I guess really one of the next questions is, but why am I actually taking the drug?
Exactly.
What's the purpose of that particular drug?
You know, it's so important to have a good dialogue with your provider. I can't emphasize that to our viewers enough. My own doctor, I take one prescription medication and then about 8 over-counter supplements, and my provider knows every single thing. In fact, when I go in for my annual checkup, she just reads my litany. I mean, gosh, you really did listen and you really did write that down. That's amazing. Because you just never know what might not behave well with other drugs. And don't make the mistake, viewers, of thinking that over-the-counter things are harmless. That's quite a fallacy.
Absolutely.
But in terms of the purpose for which we take medication, what ailment is being affected? What ailment that you have? And then this goes back to knowing about your body, which we talked about the last time I was here. What ailment is actually supposed to be impacted upon when I take this medication? And is this something that I'm taking short term? I've got a headache and I take this medication, the headache goes away, boom, I'm done with that. Or is it something I'm going to have to take for the rest of my life? When I find that people have a lot of trouble, we were talking about attitudes at the beginning of the show. Oh my God, I don't know why I'm taking all these meds. I don't feel any better after I take them. And so my standard response is, would you feel better if you had a stroke or a heart attack? Because a lot of times the things that we take that we really don't feel any different taking are things that are meant to prevent catastrophic events. We take cholesterol medication to lower our cholesterol so we don't have a stroke or a heart attack. We take the blood pressure medication. We take the anti-arrhythmia drugs so that we don't have these terrible things happen to us that could be life-threatening events, and we don't land in the hospital. So you won't necessarily feel better, but these drugs have been tested, tried and true, and they have been found to really prevent serious things from happening to the body. And my advice to my patients is to bite the bullet and just go with it. As long as you're reacting well to it and you're tolerating it, go with it. Well,
and you know, it's funny because my experience has been that when people go to a doctor's office, they very much trust what the doctor's saying and what the doctor prescribes, but then don't sort of really get into the fact that they're still responsible for managing, again, the dosage, the frequency, and knowing what the drug is for. It's good to trust your doctor. Your doctor's been trained to be able to identify what drugs to prescribe. So that's a good thing.
That's right.
But it doesn't mean that you aren't responsible or shouldn't be responsible for knowing why you're taking it, what it is, because you're the one who's taking it.
I think sometimes I imagine to myself when doctors send patients home, gosh, how do they sleep at night not knowing what this patient is going to do with this medication? Because they have no way of knowing. A lot of times people are on edge and uncomfortable when they're in an unfamiliar environment like a hospital or a nursing home, and then when they come home to a safe, secure environment, their whole oh, I'm home and I'm
Absolutely.
safe, attitude changes, and their body relaxes, and then the demand for the dose of medication they might be on might shift.
Right.
And so this is where your awareness of how a drug is acting in your body and whether or not your body is metabolizing it properly, whether or not it's the right dosage for you, whether or not you're getting some funny reactions from the medication. This is where all this comes into play, because doctors, although well-educated and brilliant in knowing what to prescribe for what condition, they cannot predict, because everyone is different.
Absolutely.
Everyone, you know, when a drug goes into the body, you know, it's kind of like the music goes round and round, ho, 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 and it comes out there. Well, if there's something wrong with the ho, 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 like if you have impaired liver function, you have impaired kidney function, you have lessened GI motility, which is stomach issues, and you have, you don't produce certain chemicals that help to metabolize the drug, it doesn't get utilized and excreted properly, and it could hang around in your bloodstream and cause toxicities. So there's a lot of things that we can trust our doctor for, but we have to also learn to trust our own instincts about how we're feeling.
Absolutely.
And we need to be able to report either to our visiting nurse or the doctor or the pharmacist, you know, hey, you know, doc, ever since I've been taking this drug, this is happening, and I don't know whether it's related. We don't try to make the patient responsible for diagnosing whether or not they're having a side effect or the symptom of an illness, because quite frankly, I don't think I would be able to do that in a lot of circumstances. But what we do expect is tell somebody, please tell somebody, because, I mean, it's just a simple adjustment of a pill.
Right, of a dosage or a frequency for that matter.
Or a frequency can make, because some pills, when you take them, they act very quickly and poof, they're gone. Other pills, it takes them longer to produce a beneficial effect, and they hang around the body longer. So, I mean, dosage is extremely important, but also awareness of whether or not you're feeling well.
Sure, yeah, and that's sort of tied to the action of the drug, right? That's sort of what you were talking about just then.
That's correct.
What I'd like to do, and we might come back for a second or two to perhaps drug interventions, because I think it's important to talk a little bit about that. But I also I want to make sure that everything that we're talking about today and everything that you've been talking about is related to the work that you do with patients, is it not?
Oh, absolutely.
And so I'd like to just give our viewers an opportunity to hear a little bit about how a Rutland area VNA and hospice nurse would in fact interact with them around medication education and things like that. How does that work?
It's very important for us to actually look at everything that the patient is taking, both over the counter and prescribed. Eye drops, creams, ointments, patches, not just pills, because all of that gets absorbed into the bloodstream. And it's when it's absorbed into the bloodstream that the medication impacts on the body. That's how the drug works, by absorbing into the bloodstream. And so when we ask to see the medication, we want to have a complete list. Because a lot of times, especially if patients have different providers, they don't necessarily talk to each other, and the right hand doesn't know what the left hand is doing, kind of thing, and even their own primary doctor doesn't have a complete list of medications. And once we have established the complete list, we have a really neat program in our computer that allows us to click on adverse interactions. Now, adverse is not good, and they come in 3 categories, 1, 2, and 3. 1 being the worst, 2 being not great but not the worst, and 3 being it's okay. And when we get a 1 or a 2 adverse interaction that pops up on our screen, we are mandated to report that to the physician to see if he wants. Sometimes they'll change something and sometimes they won't, because in their best judgment, the potential for this drug adversely interacting with another drug that is outweighed by the benefits that the patient receives by taking this drug. But a drug interaction can take place when one drug combined with another affects both the drugs. Usually the effect of one drug is either increased or decreased. And you can actually have beneficial interactions. Like, for example, if you combine two different types of diuretics, something like hydrochlorothiazide and aldactone. The aldactone prevents the body from losing potassium, where the hydrochlorothiazide, you will lose fluid, but you'll also lose potassium. So those two interact beneficially with one another. And then sometimes when people are taking probenecid with penicillin, that actually increases the effectiveness of the penicillin and lasts in the body to kill the infection and hang around longer in the bloodstream. So that's a beneficial interaction. Where we get into problems, as I said, with adverse interactions.
So because I actually have to wrap up, I just want to try to summarize what you just said, because I think it's important. When RAVNAH comes into a home, and we do have that interaction in the home with the patient, we have the opportunity to perhaps more than perhaps any of their other providers get all of that information about their drugs, whether prescription or over the counter, and then we get to report that to the appropriate
for the benefit
provider.
The benefit of the patient, and that's the important thing. That it takes time and it can be annoying, and a lot of times it just feels like it's a waste of time, but it never is a waste of time in my opinion. And we didn't even get to talk about side effects. The time went
so
my favorite topic.
I would like to thank you very much.
You're welcome.
For joining us today. This was really super informational. I hope we've given you all some good information about drugs and medications. If you or someone could use help, please call RAVNAH at 775-0568. For Home Care Connection, I'm Harry Snyder. See you next time.